Good morning. My name is Barbara Amparo, and I'm here to report about cardiac stress tests. What is stress? Stress can be caused by any type of physical or emotional stimulus or situation. Often people speak of different types of stress, such as work stress, relationship stress, or parenting stress. Every day, we are in a situation that can give us stress. Dealing with so many things in our life is difficult. Being a mother, a wife, an employee, a student are just some examples on how we encounter stress. Looking after our heart is very important because without our heart, where do you think we are right now? So, what is the purpose of this test? The purpose of this test is to check the heart's electrical activity, find the cause of unexplained chest pain or pressure, or this could be caused by a heart attack, inflammation of the sac surrounding the heart, or pericarditis. It also checks how well the mechanical devices that are implanted in our heart, such as pacemakers, are working. These devices help to control the heartbeat, and also checking the health of our heart with other diseases or conditions that are present. Number two, how is this test done? So this test, during the stress test, the doctor aims to find out the patient's heart rate, blood pressure, breathing, and how tired they feel under different levels of physical activity. The test also involves an electrocardiogram, ECG or EKG test. This is a simple test that records the heart's electrical activity. It helps the doctor understand how well the heart is working. An ECG shows how fast the heart is beating. It also analyzes heart rhythm and measures the strength and timing of electrical signals as they pass through each part of the heart. Wires with electrodes are hooked up on the patient's chest, arms, shoulders, and legs. Toward the end, the patient may have to breathe in a mouthpiece. So there's a step-by-step procedure on how this test goes. On a treadmill, the patient is hooked up on a device that monitors the heart, a blood pressure cuff around the upper part of the arm. A patient stands on a treadmill. The treadmill starts to move and the patient walks slowly. The treadmill speed gradually increases. The treadmill go into uphill or incline or position. The patient breathes into a tube for a minute or two. After slowing down, the patient gets off, stands still for a few seconds, and then lies down. The medical team takes further readings of blood pressure and so on. So the next question is, how long does this stress test take? The stress test will last no more than 15 minutes. The doctor needs to work the heart harder than normal from 8 to 12 minutes. But if the patient has any of the following symptoms, the doctor will stop the test, such as dizziness, severe panting, high or low blood pressure, arrhythmia, chest pain, abnormal changes detected by ECG device. That's why qualified medical professions are always on hand in case adverse effects. Number 4, what diagnostic imaging department should be the unit clerk needs to contact in order to book the assigned test? For the unit clerk, then they need to contact the cardiovascular unit or the cardiovascular department. And what are additional tasks would need to be completed by the unit clerk for the assigned procedure? First, for the tests such as diagnostic imaging, a client usually must go to the department for the procedure. The unit clerk arranges for transportation and must indicate the mode of transportation. The client may be transported by nursing staff, department staff, or usually via the hospital portering system. The hospital unit clerk is also responsible for communication of information about a client that may require specific care from the testing department. This information may include a variety of factors such as unable to speak English, hearing or sight impaired, diabetic, epileptic seizures, use of oxygen, or receiving intravenous fluids. And the last one is what other departments with the hospital unit clerk need to be contacted with in order to complete this additional task. For I could say ultrasound, X-ray, laboratory, CT scan, because there will be positive results that can still the doctor will still request for more tests, and then there will be a negative result that for sure the doctor will automatically request for some more tests to further study what's going on with the patient's heart or with the patient's condition. For my conclusion, if symptom persists, consult your doctor. This is not just for advertising, but to always remind us that our health is wealth. I know we are busy with our jobs, household chores, and all the people around us, but we need to look after ourselves too. When we feel like something is not right, please don't hesitate to see a doctor before it's too late. Thank you for listening and have a great day. Bye bye.